On behalf of the Vancouver Canucks, I want to thank everyone for their messages of support for our team at a difficult time. This puts into perspective what's most important, our health and the health and well-being of those we love. Many of our players, staff, and families' health has improved. We'll continue to prioritize efforts to ensure the full recovery of our entire Canucks family. From the bottom of our hearts, thank you to our medical staff, BC health officials, and the NHL, NHLPA medical experts for their extraordinary care and guidance. And with that, we'll open up questions.
Okay, we'll get started here with a first question from Brendan Batchelor from Sportsnet 650.
Hi guys, thanks for doing this today. This question's for you, Dr. Bovard. Just do you have any updates or information further to the statement that you released in terms of developments with cases within the team and the organization, or recoveries as well?
Thanks, Brendan. Yeah, it's been busy the last number of days this past week, and I can say we're following the curve like every other curve, where we had a peak in cases. You've seen how they've been released each day, and it's starting to slow down. So we're moving away from the new infection phase into the dealing with the infection phase, and then starting into the recovery. So happily, we're getting more towards that stage of this, of this wave within our organization.
We'll take our next question from Richard Zussman, Global News. Richard, do we have you there?
Oh, yeah, I'm here. I'm just wondering if there's been any indication from the province that the team or the organization may need to shut down because of the new WorkSafe policy indicating COVID spread of more than 3 people within a workplace.
Jim, I can answer that if you'd like, because that's essentially a medical question, if you'd like me to.
Yeah, go ahead.
Yeah, so we've been working really closely, and I have to thank both the provincial authorities and the Vancouver Coastal Health, as Jim echoed. They've been remarkably helpful in a time when they're incredibly busy. You know, what's happening with us is really just a microcosm of what's going on in the broader community, as you've alluded to. And as you've also alluded to, policies and practices are evolving as the virus evolves and we learn new things. So as it pertains to us, they've been looking at us very carefully and working with our organization and guiding us in terms of when we can come back. And so that will be, and that's an evolving process, and we will be working with them and continue, and we will reopen and restart work only when they give us the clearance to do so.
We'll go next to Karen Larson, CBC.
Oh, hi, thank you very much. I'm hoping you can hear me here. Yes?
Yeah.
Yeah, great. Thanks. My question, I'm not really sure who wants to take this on, either of you, was about the initial case of COVID that came onto the team. Was that the result of that person not following provincial health orders or NHL COVID protocols? And could you give any details?
Jim, go ahead.
Yeah, so what I can say is you're correct. It is an individual in the organization. And I think the key point there is we look at it, it's not an accident that it occurred when it did with what's going on in the broader community. We knew when our organization and workplace, just like all the other workplaces, everybody is following and trying to follow to the best of their ability, all the protocols in place. And we're no different in that way. But we work and live in the city of Vancouver. And we know that the individual had gone to a place within the guidelines, and that place subsequently was discovered to have cases of COVID, and that's how it got into our organization. And we've made it very clear within our group that there's no culprit here other than the COVID virus itself. Everybody's been working incredibly hard in the last year trying to avoid getting it, and in spite of their best efforts, this can happen. We're seeing that in the community, and what I'm seeing going on here in the organization is not much different what I'm seeing in my own office with people in all walks of life, all workplaces. It just seems to be occurring in a much greater frequency within our group as well as within the community.
We'll go to Ian McIntyre, Sportsnet.
Hi, gentlemen. This is a question for Dr. Bovard. And a two-part question. Is there anything about this outbreak that has surprised you from a medical standpoint? And where are we on the timeline of from the start of it to the end of it and the team is back to play? Are we past halfway? Are we 2/3 or 1/3? Could you please speak to those?
Yeah, Ian, great questions. I think I'd say that, frankly, if we go back to January of last year when our hospital at Lionsgate admitted the first person with COVID disease, we're continuously learning more and more about it. And so I think we've learned to expect the unexpected, plan as best as you can, but you then need to learn from what has happened. So, we saw how fast this hit. This virus is very contagious. It spreads quickly. And we've seen that over the last week. We are moving now more into the phase, rather than having increasing new cases, is now dealing with the cases and continuing to work through that in terms of their health. In terms of how this plays out, it's a bit of an unknown with the with the virus. We have some expertise from other organizations when they've had it, and so we're just taking it day to day right now. And my focus as the physician to my patients, in this case the players and others in the organization, is to just manage each and every one of them step by step through this virus, and get them back to health, and then get back to their ability to do their jobs as quickly and as safely as possible.
We'll go to Patrick Johnston, Post Media.
This is for Dr. Bovard. How can you fill in maybe the timelines of us? I guess you guys had the working theory that it was P1. As I understand it, there's actually a lot of information that you can get on terms of the variant based on the initial PCR screens in terms of some of the mutations that come back in that testing. I'm just wondering if you can sort of fill us in on that. And then as well, whatever you can say, it seems to me that there's a story here to be told about masks that, since so much of the support staff have seemed to avoid an infection and were presumably wearing their masks. I'm wondering what you can sort of tell us about that.
Sure. So the first one, what we do know is that it is a variant. The process for determining what kind of variant is much more complex, and it involves sequencing the entire genome. And for those of you who are old enough, remember the first time we sequenced the human genome, was essentially a miracle of human ingenuity. So we sort of take it a bit for granted that you can just rattle these things off. It takes time to run them. They are running them. As a clinician, it doesn't change how I manage my patients. So that's more of interest to the public health people as they guide it. But in terms of how we're managing, I manage each of my patients. I treat them based on what I see in front of me each and every day. In terms of masks, we know that part of this, with the players going back and doing their job where they can't wear a mask, they don't physically distance, that is going against two of our basic weapons we have to protect ourselves against COVID. So we know that it can be a concern, and therefore we put into place all the measures that we have. But given the speed at which it went through, and we got to remember, we've been doing this now since last June with players going back. So we've had a lot of experience, and the fact that this is such a remarkable outbreak just speaks to how well we've managed to deal with this. However, variants, the virus is smart. It changes. And so we will be looking at this, and I'll be passing along all the information I can up to the league and the Players Association, and they will analyze that with infectious disease experts. And if there's changes that are going to be made to policies based on that, they will be brought down, and then we will implement those.
Okay, next up is Farhan Lalji, TSN.
Either one of you can weigh in on this. Maybe we'll start with Dr. Bovard, but just around your protocols for test results being received and timing of group activity, particularly practice. We saw a situation with the first case where the tests were received midway through practice and then the player was pulled off it. And certainly there's the possibility that spread could have occurred during that time. Is there a revision of that type of policy to be had going forward in terms of when results need to be received versus when players can gather and be on the ice or any kind of group activity?
Yeah, Farhan, that's a great question. And again, that's one that I'll defer to the NHL, the NHLPA, and the infectious disease experts as they sort of analyze this. And that'll be one of the pieces I'm sure they're going to look at. And as always, you always want to, can you do things better? And if you can, we will from what we learned. So that remains to be seen. Having said that, our timelines have been no different since last June all the way along. And they've served us well. Maybe there's something new and different from from what we're seeing right now, and if so, we will implement those changes.
We'll go to Gemma Carson-Smith, Canadian Press.
Hi, gentlemen. Question for Dr. Govard. I'm wondering if you can speak to the symptoms players have been experiencing. We've heard a little bit about some different stuff, but just to clear up, what have these gentlemen been going through? How serious are these cases? Has anyone required IV treatment, as has been reported? Has anyone been into hospital? What can you share about that?
Thanks for asking, because that puts that back to this is a very human situation, and we're dealing with illnesses and people, and we've had the whole range of what I've seen in COVID throughout my practice over the last year. Nothing unusual, nothing different. The range of what it's like to deal with having the infection, to being a close contact with the infection. And so I'm happy to say there's been nothing unusual. There's been nobody who's needed to be hospitalized to date. So I'm pleased with that. It's been a tough week. It's been a tough week as a physician when you're reporting this information, because pretty quickly, these players go from being hockey players and some of the most resilient, toughest, well-balanced people on the planet to suddenly their fathers, their husbands, and their sons, their brothers, and it takes on a whole different element for them. So they've been, focusing on their health and their family health. And my job with each and every one of them is to just take care of them and get them back to health and back to their healthy family lives and back to their workplace as soon as we can.
Next up is Jay Janauer, Global BC.
Dr. Bovard, thank you for making yourself available to us. With what we've all gone through in the last year and the fact that we have new variants that we're dealing with, what surprised you or what really opened your eyes to how this hit your organization and hit it so hard when we know the protocols that you've been following? We know that the players wear masks when they get off the ice. What surprised you the most about this? And could we also assume that perhaps this transmission occurred because of them being on the ice with close contact, because they were following protocols when they were off the ice?
Yeah, I guess in one way I have to say I'm not surprised. I don't want to sound jaded, but I've been dealing with this as a medical professional for over a year. I've seen my colleagues in the hospitals. You've all heard about the impact this has had on care workers in hospitals and outbreaks there, and how each time there was one, they learn from it and then they make adjustments. And if you're noticing now, you're not hearing about healthcare workers getting sick with COVID like they were. Well, why is that? Well, we've learned more and we've brought into place, different policies and procedures. And again, we will look at this. We're going to work with infectious disease experts. We're going to work with the fellow who's done, I believe, hundreds of these outbreak evaluations throughout the province for all sorts of workplaces. And he's going to bring his expertise and knowledge, help us look at it, see what we can learn as an organization, what we can pass on to the league and on to other teams in the NHL, and frankly, all professional in any team sport environment. If there's anything we can pass along that will help them know more, then we will.
We'll go now to Martin Klinkenberg with the Globe and Mail.
Hi, this would be for Mr. Benning. I'm wondering, of course, the most important thing is everybody's health. That's the most important thing. But also you have the practicality of kind of a narrow window right now for the remaining part of the season. So, are you having discussions with the NHL about how this can be handled? And is there a possibility that, you know, you won't be able to play any more games?
Well, I think later on this morning or at noon, Dr. Bovard, John Sanderson, our head athletic trainer, the doctor from the PA and the doctor from the NHL have a meeting, you know, to discuss the various, you know, problems that we've had going through dealing with all of this. And they're going to, I think for the most part, our players are on the other side of it. We have still family members that are getting sick, and you know, I think the players worry about that. So, but I think they're going to discuss today about an opportunity to open up our facilities again to get our players back skating, and you know, and then from there decide like when we're going to start playing games again. My conversations with the league are that we're going to continue with our schedule here at some point, and we're going to play all 56 games. So those are the conversations I'm having right now with the league.
And if I could just add to that, the other part of that, he's absolutely correct. We will have a meeting. And as always, the final decision about our ability to go back into operations is no different than any other workplace in the province. It will be public health will listen to our report and what we're going to do. And then we will have to get the green light from them to return to work. And that will be the final step in the process.
Great. We'll go now to Thomas Drance, The Athletic.
For Dr. Bovard, as you've watched through this infection and discussed it as a microcosm of what the community is experiencing at large, are there any lessons the public should take from a high-profile outbreak of this sort?
That's a great point. And, you know, I can speak absolutely emphatically to everybody out there. You do not want to get this virus. So do everything you can to not get this virus, not just for your sake, so that you're not potentially passing it on to others. I see this not just with the hockey players. I see this in my practice, and I see the concern it creates in individuals when they worry that they may have given it to their mother or their grandmother or someone else. So really just stay abreast. You're seeing how this virus changes. The provincial authorities are following this closely. They're updating their recommendations. So stay up to date. Don't assume you know what the latest and proper precautions are. Just keep up with that. And, you know, but the basic ones haven't changed in an entire year. Physical distancing, wearing a mask in close quarters, and careful hand hygiene. 3 basic things. And the fourth one is the idea that, you know, you don't go to work when you're sick. And to drive that point home, it's like, you know, one of the players said to me, I was talking to him about that, you know, like the next generation of players are going to go, yeah, you went in when you were coughing and hacking and they say, yeah, you know, unless we were on, you know, really couldn't go. We played. It was a badge of honor. You went and played. And he said it's sort of going to be to the next generation of hockey players like the last generation that would smoke a cigarette between periods. You know, how ridiculous does that look now? It didn't look unreasonable back then. Everybody was smoking. Well, that's going to be one of the biggest differences, is that people have to be aware of infectious diseases and they have to be aware of their health. And that applies to everybody. You know, so if you're sick, stay home, isolate. Doesn't matter what you're sick with. Stay home and isolate. And in terms of COVID specifically, follow the measures: physical distancing, wear masks, careful hand hygiene.
Okay, we have time for 3 more questions here for this part of our availability. We'll go to Nick Kotsonika with NHL.com.
Hi, Dr. Bovard. Jim said that for the most part, your players are on the other side of it, but their family members still getting sick. So 1, can you quantify that in any way or describe that in more detail? And 2, what are the benchmarks that you're going to discuss later today in terms of, like, what are the things you need to see to open facilities and play games again?
Yeah, everybody's flowing through it. There's nothing different about the way this flows. I'm going to predict, as the people who are listening, you know, to this webinar have experienced it either directly or indirectly through family members. So it's really no different than the range that you've seen. So that's what they're going through. What really is in their favor is they're all young. We know that younger people, by and large, have more resiliency compared to early in the pandemic when it was our people in our nursing homes and people at home who were more frail, who are at higher risk. So that's in their favor. But we will work through them step by step. And then in terms of opening the facility, public health basically have to see that it's safe. That's their priority. Is it safe from an infectious disease point of view to open up? I owe that to each of my patients, all the other staff members, all the other players, and everyone else who's going to come into work in our facility want to know that they're coming to work in a safe place. So we will be looking at what does that mean? What does that look like? And then have a plan put together and submit that to public health. And only if they give us the green light, we will then proceed and open up.
Okay, and now we'll go to Jeff Patterson, The Athletic.
Hey, Jim. Obviously, health is first and foremost of the players, but you've talked about the league wanting you to resume your schedule and complete the 56 games. Realistically, what can you expect from your guys? They've never been through anything like this, obviously. There could be some after effects for some as opposed to others. We know that playing at this level takes a toll on players physically. I mean, realistically, what can your expectations be of your group here when they resume and start playing games again?
Well, that's something that, once we go through it, well, I guess we'll just have to see. Like Dr. Bovard has said, like the first, order of business is getting our players healthy, getting them back skating, working out, and having good communication with them as to what they're dealing with, how they feel, and then ramping it up to where we have some team practices, and then from there, actually playing the game. So, this is new to kind of everybody in our field here, like with a pro team, and we're just going to have to go through the process, and just as we go through it, we'll learn more. And I don't like our expectations. We're going to be, once we're healthy and we're ready to play, and I expect our players are going to be competitive here down the stretch. We got a hardworking group, a team that has a lot of pride. So our schedule will be hard. We're going to have a lot of games in a short period of time, but we'll just see how they feel and how we come out of this and see where it goes.
Okay, and we have time for one more here. We'll go to Daniel Wagner with Vancouver is Awesome.
Dr. Bovard, you've talked about the importance of following provincial guidelines and that the individual in the specific situation with the Canucks was following guidelines, was following NHL protocol. Does that mean that stricter guidelines such as preventing indoor dining might have protected the Canucks in this case?
The virus is tricky. Things are evolving, and we can go back and say a whole bunch of what ifs in different ways, but we got to learn from it and move forward in terms of how we manage it. Again, this virus is tricky. It's changing, and we need to change with it. If we could anticipate what it's going to do next, our jobs would be way easier, but they're not. We don't know what it's going to do next. And so we just got to look at what we know now and then make sure we learn from what's happened and implement that. And that's really where the focus will be by, in this case, the NHL and the NHLPA. I'll share with them what I've learned with my patients at the individual level, managing it. And then they can take that along with what we learned from our infectious prevention and control experts. And then they will, they'll take that advantage, as will public health, provincial public health. They're very interested in what's happened with us. What can they learn from this that may apply to other workplaces?